Okay, right now we are going to cover legal blood draws. We can be asked to do those in the ED at the request of, law enforcement agencies. You have FHP, JSO, Atlantic, your beaches, police, and things like that. We don't see it often, Flex ECC, but it certainly happens. And you do run into officers that may not be familiar with the requirements of our steps, so it's important to be mindful of it. An officer will come up to you and ask you if you can please do a legal blood draw. They should approach you with a box that is sealed. Okay, you have your integrity seal here. If it is broken before it comes into your view, that box is not usable. All right. They're walking up to you and they crack it open while you're doing things with the patient. Still not acceptable. You need to witness that officer open this box, or else it is not viable, and you have to ask them to please go get another one. So another thing as well, they may have consented the patient before they get to you, and when it's time for you to do the blood draw, hey, have you consented, Mr. Nakashi? Hey, Mr. Nakashi, remember what we talked about? You said we could do this. No, the officers do know that there is a full legal disclosure that they have to go through to get consent from our patient to be able to do this, because you have to witness this patient saying, yes, I consent, or no, I do not wish to have my blood drawn. The cops have to go through the full disclosure, because they are not just testing for alcohol, they are testing for, drugs, medications, things of that nature. And the patient has that legal right to know that. So we're going to say that everything was consented appropriately. The box is opened in front of you. We're going to use the already opened box here, okay? This is our bag. This has got your povidone iodine swab in it. You swab the area that you are doing. The foil packet stays in here. Put it back into this bag. Stays with the box. You have, this is an instruction sheet, the blue sheet for the officers and the steps they have to take. On the blood collection form, you have sections 2 and 3 apply to whomever is doing the blood draw. Some officers might fill this out, the section 2, but you'll have to give them all your information. It's perfectly okay for you to fill it out if the officer is comfortable with it as well. And then section 3 is a section that you fill out and you sign in regards to the area or to the draw that you are about to perform. Okay, so that's being done. The patient signed because they've consented. So inside of it, again, opened, okay, we have all the seals in here for afterward. This should not be bloody. These are your 2 samples that are inside of this little box here. Inside of the large box, you do have one in the little bubble wrap. This is the control. Blood does not go in this. Let's just keep it in the box. They use a butterfly, a little bit different than ours, okay? Much bigger. If you are looking at somebody that does not have really big veins, I would strongly recommend asking the officer if they are okay with us using one of our butterflies. Some may say no, they can do that. Do your best to use this. If you cannot do it, please don't continuously poke the patient using these or open up the kits. Go ahead and grab somebody that might have better luck, again, if that officer is not going to let you use our butterflies. Okay, most of them will. If you are able to use this just for patient comfort, I would recommend not using it in their hand, because this is a pretty big needle. There's no flashes like we have on our butterflies, guys. So just know your vein, make sure you hit it. The darker complected somebody is, that iodine may not show up very well either. So again, just, get a good spot so we're not hurting the patient too much if we're not using one of our own butterflies. You fill your tubes up, you hand over to the officer, they're shaking, they're sealing as you're finishing everything up and placing in here. You remain with all of this until all of this is sealed. It's all placed back into the box. Our sharps obviously are going to go into our sharps container. But all of this is sealed. They put a seal over this, a seal over this. Your initials are going to go on it as well. They do their law enforcement things. Everything goes back in here. They package up their box. Once everything is back in here that is required to be in here, there will be another seal placed. It is this one. Big seal placed on it. When this is placed on the box, you can walk away from that bedside, because now, based on the documentation that we make, everything has been completed and what you are going to chart. And if you are called into court, you can attest to having done everything that you said you were doing. What you can do to chart it is you go to your ED narrator, go into the patient's chart, blank note, and your search terms, just type in legal. And only 2 options pop up. Legal blood draw is the one that you want to do, and you fill in the appropriate spaces. Make a note, again, once everything's sealed, you can leave the bedside. So if you do that, make sure you get your officer's name, whatever agency they're from. Again, could be JSO, FHP, the beaches, things like that. Even Georgia, I believe we can have them sometimes. And note your expiration date on the box as well. And this one's still good. Okay, so yes, note your expiration date, officer name, agency, and badge number. And all that will go into the legal blood draw note. Review it again, and then you can go ahead and attach it or post it to the patient's chart, and you are good to go.